Tumors and tumor-like neoplasm of the maxillofacial region in children. The diagnostic, clinical picture, and principles of treatment of children with malignant tumors. Classification of the maxillofacial bone tumors and tumor-like in children can be divided into types. The histomorphological signs and by the characteristic of the tumor growth. In second type, we can lead to true and tumor-likes. True tumors have growth with the mitosis, and tumor-like diseases grows without the cellular development. It's mostly grows by the pressure. The true tumors we can divide to benign and malignant. And benign we divide to osteogenic and odontogenic. By the tumor-like diseases, we mostly divided by malformation and acquired. General information about the benign tumors and tumor-like neoplasm of bones in children. They have painless growing. Deformity of the jaws appears slowly. Mobility of the teeth in tumor processes. Disruption of the position of the teeth and germs. Lack of clear pathognomic clinical and radiological signs. Some neoplasm of jaws are similar. Osteogenic tumors. They consist of osteoblastoclastoma. It's also called the brown tumor or giant cellular tumor. They have the two forms, central and peripheral. Peripheral form we call the giant cellular epiploid. And central forms have three types, cystic, lytic, and socket form. Main clinical signs consist of usually they are between the age of 11-17 years old. There are a few complaints for a long time. The earlier symptom, pain and mobility of the teeth in the region of tumor. Often effect of the lower jaw with the growth of tumor is fusiform body deformation. And in tumor recurrent inflammation and can be form fistulas. For additional research methods, we used the X-ray, puncture, and pathological examination. Radiographic signs of central form. It's deformation of the jaws, thinning cortical plates, dilution jaw bones. In cystic form, we focus with the clear borders. With socket form, small cavities that are separated by the septum. Called the picture of salt bubble. And lytic form has no clear borders. Also, the root resorption of the teeth drawn in the tumor cavity were cystic forms. We can see some types of cystic form. It's one cavity and also the root resorption of the teeth. With the puncture, we can see the brown cherry color fluid that contains the hemosiderin and without the cholesterol crystals. Or we can see the blood, especially blood circulation that have the free circulation of blood in the cavity. Differential diagnostic we provided with ameloblastoma, fibrosis dysplasia, jaw cyst, simple epiploid, and osteogenic sarcoma. Peripheral form of osteoblastoclastoma or giant cellular epiploid. We can see it's situated on the gingiva, looking as a pale pink tumor that involves the gum completely. Unlikely common epiploid, the basic is white, embracing several dental areas, which are more or less movable. The tumor is often afflicted, that is why it is covered with ulceration. An X-ray examination reveals the focals of uneven destruction of the osseous tissue of the collar process. Some cases of the giant cellular epiloid and treatment of the osteoblastoclastoma. We can see the red tumor under the cortical bone. This is the common signs of the osteoblastoclastoma. It's red tumor, and after the extraction, we can see only the cavity. Osteoma. It's tumor of the bone. Consists of irregularly arranged bone trabecle with varying degrees of maturity of the cells. It can be central or peripheral and compact form or spongy form. Clinical signs. Osteoma is rarely diagnosed in children. Deformity occurs if the bone becomes giant in size. Osteoma is more commonly located on the mandible, on the angle or branch. It can also be situated on the maxilla, cheekbone, arch, maxillary cavity. X-ray signs. X-ray reveals a limited area of osteosclerosis of irregular shape, symptom of heterogeneous alteration of the bone, thickening and rarefaction areas in case of compact osteoma. Osteoid osteoma, tumor cortical layer of the bone with osteoid structure and connective tissue. Presence of the local permanent of paroxysmal pain, most intense at night. This is the one of the symptoms that give us imagine that it can be osteoid osteoma. In X-ray, we see the clear contours, sclerotic surrounding bone, sometimes with some thickening in the center, and treated the same surgically. Odontogenic tumors. First of all, it's ameloblastoma, or in another, it's adamantinoma. It's odontogenic tumor that structure of which resembles the tissue structure of the dental germ enamel organ. The main clinical signs. It develops more commonly at the age of 10 years. More often the patient complains of painless deformity of the mandible within the body, angle and branch area. Propensity to be recurrent, often diagnosed by changing during the X-ray, and malignant with repeated removal. Additional methods for it's X-ray, puncture, and pathohistology. We can see here the sometimes some forms of ameloblastoma. It located on the angle and branch of the jaw. And during the puncture, we will see the clear yellow or white liquid, sometimes with cholesterol crystal in it. Differential diagnostic. We provide with osteoblastoclastoma, radicular cyst, and follicular cyst. How it treated? We remove within healthy tissues. In the major lesion of the bone, the most drastic and effective way for children is resection or exarticulation of the jaw using a moment autoplasty with extracted replant. Or we can use the tamponade cavity tumors with uniform gauze. Its historical treatment was used by Professor Bernatsky. You can see here the puncture and white fluid. What we can see here is the partial extraction of the lower jaw with the removing of the tissue. After this, this part was boiling in the water to kill all the fragments of the tumor, and this part is used like the implant. After implantation, this part, we can see that it fixates with some bones sutures, and you can see that the movement of the jaw are not damaged. Odontomas. We can classify it with to soft and hard. Odontomas, it's not the tumor, it's malformation that occurs during the formation of permanent teeth. If these teeth that sometimes we can call it mesiodens don't have the mineralization, it would be soft odontoma. If it have mineralization, and mostly we see it, it's called hard. And it developed to the complex and simple. Simple, it's complete, and incomplete. What does it mean? Incomplete, when we don't see the shape of the tooth. If we see the shape of the tooth, we call it complete, or in other time it's mesiodens. How it look like? Tumor grows slowly, located more commonly in areas of molars, became rolled and dense, and treatment it's only the removal of odontoma. In radiography, we can see the conglomerate of the tooth-like tissues surrounded by the osseous tissue rarification area. Sclerotic area of the borderline with healthy bone is observed. Cementoma, another malformation, consists of the coarse fiber dense tissue similar to the dental cement. By the radiography side, we will see the neoplasm, spherical mostly, or irregularly shaped at the root of the tooth, closely connected with the root tooth. Epiloids, developed as a result of the chronic inflammation in periodontal. It's non-tumor disease. It's inflammation disease. They have the fibrosis form and angiomatosis. Fibrosis form, it's have smooth surface, light pink color, and has a leg. Angiomatosis have the bumpy surface, blush color over mucosa, soft elastic. Injury lead to easily bleeds, and also have a leg. Treatment consists of tooth treatment or extraction, removal of epiloid, and also can be the electrocoagulation of underlying tissues. Fibrous dysplasia have different forms: mono and polyosseous form. Cherubism, it's location of the fibrous dysplasia on the mandible area of both angles and branches. And Albright syndrome, which is more common among girls, and consists of affliction of the maxillofacial bone, skin pigments, and premature puberty. Clinical picture of fibrous dysplasia has hereditary jaw deformity, may occur by chance, cause displacement of teeth, characterized by periods of exacerbation and remission. Can be pronounced pain on palpation, mobility of the teeth, simulating acute abscess or osteomyelitis of the jaw, only simulating. You can see in the X-ray, it's characterized by destruction of osseous tissue with distinct of white borders at early stage of development. Depending on the osteoid tissue maturity, sclerotic fossil appear, and a bone look like frosted glass. Periosteum always left undamaged. This is some case of the hereditary cherubism. On the left side, you see the son, and on the right side, and mother with the same disease, the cherubism. But son have the more lesion. His bones, upper and lower jaw, have their dystrophic and destruction changes in all parts. What its bone look like frosted glass? You can see here it's like have the holes there, more and many holes in the cortical part, and these cortical bone are very soft. Principles of treatment: sugar bone cartilage with the jaw deformation surface. So we distract all of the bone that give us deformity. Also, we use a drug therapy, antihistaminic preparation, vitamins. Locally, it can be antiseptics to treat or line the sutures of mucous membrane, and orthodontic and orthopedic prevention of secondary deformities of jaws and teeth. Cyst of the jaws. We divide in odontogenic and non-odontogenic. Odontogenic divided also in inflammatory origin and non-inflammatory. Non-odontogenic we divide into traumatic and development defect. Temporary dental radicular cyst. The teeth contain have slow development, express bone deformation. Palpation may determine solid malformation. Dupuytren's symptom, the permanent crankle symptom, vestibular wall thin is the same. And color of the mucous membrane is unremarkable. X-ray signs. We will see the homogeneous rounded bone clarification with distinct borders. At radicular cyst, its cavity contains roots of the causative tooth. The follicular one have the permanent tooth follicle. Some cases of the radicular cyst. And after the extraction of the tooth, we can see the small radicular cyst. Follicular cyst. Developing enamel organ of teeth, often we can see with second or third mandibular molars. Rarely diagnosis in children because they need the time to develop the third molars. In the characteristic clinical and X-ray signs, follicular cyst. In follicular cyst, we can see the permanent tooth. And also we will see the same, the homogenic lumen of the round-shaped cyst with distinct contours, and in the follicular one there is permanent tooth. Sometimes some cases of the follicular cyst that was grown in maxillary sinus. After the extirpation of the cystectomy, we can see inside the tooth. The traumatic cyst have the origin of the epithelial elements that related to the debris of the embryonic epithelium in the dental plate. The characteristic, clinical and X-ray. Slow development, expressed bone deformation, the homogenic lumen of the round-shaped cyst with distinct contours, and not connecting with the causative tooth. Some types of this is some case of the X-ray of traumatic cyst. Clinical picture of the traumatic cyst we not always can see. Like the others, tumor or tumor-like bone diseases, we can see it by X-ray. And punction give us only blood. How we treat all type of cyst, not only by the all type of cyst. We have two types of treatment. It's cystectomy, when we remove all of that cyst, and second, different type of cystectomy, when we remove the cyst and leave all shape of the bone. Here we wait for the formation of the bone. This is what it look like in the intraoperational. You can see the cyst and cavity that formed by the cyst. Eruption cyst. We can it's look like the soft tissue is marked deformity and swelling over of the eruption tooth. Mucosa under them mostly blue with blue color. And treatment, we only excision the tissue over the coronal part of the tooth. Thank you for your attention.